Hello, I'm Dr. Beth Godey.
And I'm Dr. Martha Leatherman. I'm a geriatric specialist in psychiatry.
And I'm a neuropsychologist, and I specialize in aging.
We're experts in dementia care, and we're here to provide you some information and answer some questions that we hear very commonly about dementia and other issues in aging. How was your week?
Well, my week was good, but I saw a patient that reminded me of a really common issue that you and I encounter. The lady had been married for many years, and her husband had died, and the family was concerned because she was not functioning as well and not keeping track of things and can't seem to do things as well as they expected her to do. And their question to me was, is she grieving the loss of Dad? Mm-hmm. Is this really a depression? Mm-hmm. And perhaps does she need some grief therapy? Mm-hmm. And that brings up an interesting issue about what is depression and could that be grief?
You know, depression and dementia in the elderly have a lot in common in terms of their symptoms. They can look very, very similar. And it's an important question to ask because the approach to treatment and management is different for the two of them. And depression affects people's brains. It causes people to have trouble eating, causes people to have trouble concentrating and even remembering things. There's a term that we use called pseudo-dementia, which some people with severe depression get, where they actually look like they have dementia, but it's depression.
Right.
When I see these situations, what I'll often hear is, we noticed over time that, my dad was maybe doing more of the cooking, answering the phone, and we thought Mom would pick those things up again when Dad died, and she hasn't.
Right. Those are the clues that we get when we talk to families, that one spouse is starting to take over more and more of the daily responsibilities. And then when they're gone, the other spouse, who may have done those things in the past, mm-hmm. can't resume those activities. And it is a delicate balance between what is depression and what might be memory problems associated with dementia.
Well, and you see, what happens is that you've got two people who've lived together for some time, years, and it doesn't have to be a husband and wife. Sometimes it's a parent and child, siblings, you see it in religious orders sometimes, but most commonly a husband and wife, and they take over and fill in parts of each other's functioning and lives. And then when one of them is gone, the remaining spouse does not have the cognitive ability to resume that. And you really do have to think about an early dementia.
Right. The other thing that comes up with families is that they begin to question whether or not Dad had been covering for Mom all those years, or that one of their siblings, who is now gone, had been covering for Mom during those years when they took care of her. And so that's one of the most common issues that arises. You've got two people who have been living successfully because one of them has a brain that actually works well still, and the mm-hmm. other needs some extra help. But it's very difficult to tell just from the report of the family what's going on. Really, you need a very good evaluation mm-hmm. of the person's abilities, their cognitive function, their medical status, to determine what is really going on.
And this is sort of off the point, but I have to point out that if there's been a long illness, the spouse remaining may have been caregiving, may not have been eating properly, may not have been resting properly, may have been drinking too much. That's an increasingly common problem among elders. The take-home message in this is that you can't just assume that it's depression or grief and it will go away. You really need to get things evaluated both physically and psychiatrically, mentally, psychologically, and figure out what you're dealing with so you can move on.
Exactly. Now, in the next part of this, we're going to continue on this theme of what happens when the spouse or the loved one dies and the person is continuing to ask what happened to them or where are they. Is that part of the depression or could that be part of dementia? So we'll talk then.
For more answers to questions like these, our book, The Insider's Guide to Dementia Care, is available at Amazon.com.